Many friends and family have questions when a patient goes to the University of Iowa's Medical Intensive Care Unit. This unit is often called the MICU. The goal of this brief video is to answer some of your questions, but you can ask questions at any time. We encourage it, because we know that having the answers can ease concerns and help you be even more confident that your loved one is in the right place, in the right hands, and getting the best possible care. Let's start with what is often the first question. Why are we here? You are here because your family member needs specialized medical help. In the MICU, the trained, experienced, and compassionate staff is equipped to care for those special needs. The MICU is a secured unit. To protect the privacy and safety of our patients, you will need to ring the doorbell on the wall to be let into the unit. As you enter the unit, to your left on the wall is the foam in and foam out station. This quick step will help to lower germs and bacteria from being spread as you come and go on the unit. When a patient comes to the MICU, our medical team's focus will be on moving the patient into one of our 26 beds and caring for their needs. Someone will send you to one of our 2 waiting areas. The first waiting area is a consult room inside the unit's double doors on your left. The larger waiting area is just outside the unit's double door, but still very close. You will be asked to wait in one of these rooms. You will be given a packet of information which has our request for information form. Your time spent in the waiting room is the perfect time to fill this out. This is also a good time to take care of your personal needs, like finding the restrooms, a drink, a snack, or returning phone calls. We suggest you talk to a unit clerk before leaving the waiting areas so we know where to find you if we have news or questions. Many important things happen in the MICU when a patient comes to the unit and you are in the waiting room. Moving to the MICU may have required the use of portable equipment and medical aids. These will need to be removed. Equipment in the patient's new room will need to be carefully placed and started. The new care team will also use this time to do critical assessments, evaluate vital signs, go over care orders, and give medicines. After staff has made sure that all critical needs of the patient have been addressed, someone will bring you to your loved one. When you reach the patient's bedside, you may be surprised by all of the monitors, sounds, and other machinery in the room. Each piece of equipment has a purpose and all of them will make noise at various times. Pumps delivering fluids and medicines into veins will beep when a medicine is running low, if there is a kink or bend in the tube, or it may be a low battery indication. The monitor above the patient's head gives visual and audible signals to the staff. Nurses keep track of these sights and sounds because they report heart rhythms, levels of oxygen in the blood, and other important information. Some patients need help breathing and may be using breathing machines. These machines may sound alarms if a patient coughs, breathes too quickly, or if the humidifier runs low in water. All nursing staff and respiratory care staff know these signals and will address them as needed. Many of the in-room monitors send reports electronically to the nurses station. While many of the sounds you hear do not mean there is an emergency, they are part of your loved one's care. We strive to keep the noise down, but if you find the noise levels for you or the patient disruptive, please tell your nurse. We may be able to provide headphones or white noise machines. All beds have a hand controller with a nurse call button. If you have a medical care or question, please press the bedside call button. Staff will respond as soon as they can to ask what you need.
How can I help you?
Sometimes your care team may be with another patient. If you see staff at the nursing desk when the patient's call light is on, this does not mean the call light is being ignored. In an intensive care unit, the nurse station needs to be staffed at all times. If staff is at the station alone, they may be waiting for another staff member to take over watching the pod monitors before they can leave their station. Please know that someone will respond to your call light as soon as they can. From time to time, you may see a group of people talking near the patient's door. Do not be alarmed by this. Based on the time of day, the gathering by the door or nurse station may be at shift change. Someone going off duty may be bringing the new staff up to date on progress or changes. Or it may be rounds. Rounding is the care team's chance to talk about changes in condition or possible changes in treatment. Doctors will hear from nurses and other medical departments about how the night went or how the patient is tolerating new medicine. The University of Iowa Hospitals and Clinics is a teaching center. The medical team will be using a lot of medical terms and may be using the opportunity to teach students. Many visitors listening to these conversations may find it very confusing and hard to follow. After the care team meets outside the room, someone will enter the patient's room to share what was discussed. Medical providers in the MICU take part in rounds at least once a day. This tends to be in the mornings. The order in which a patient is seen is decided by their critical status, new admissions, and other factors. All patients will be seen before rounds are complete. A care provider will enter each patient's room to talk about test results, care plans, and answer questions. You are welcome to be there when team rounds happen, but if for some reason you are not here during that time, do not worry. You can ask for an update at a later time, and someone from the care team will come in to speak with you. Staff will make all efforts to keep you informed. Ask your nurse your medical care questions. They can give your questions to staff or bring them up during rounds. The nurse unit clerk desks are in 2 places in the MICU, and they are the people to ask non-medical questions. There are also many very helpful and informative pamphlets near the unit clerk desks. The pamphlet racks have maps showing where food and drink can be found, parking choices, where to find lodging, cell phone charging stations, and much more. Asking your non-medical questions to nurse unit clerks lets medical staff stay focused on medical details. As visitors watch the hospital care team in action, they often wonder what they can do to help. It is natural to want to help and be involved. If you feel this way, ask your nurse for suggestions. One way to support your loved one is to not visit if you are sick. We know you want to be with your loved one, yet the person you are visiting and likely others in the MICU may have weakened immune systems. If you suspect you are ill or starting to feel ill, talk to the nurse about your symptoms. We will be happy to help you decide if you should visit or perhaps you should wait for a day when you are healthier. Remember, take care of yourself. Are you eating right? Have you been sleeping? The hospital has many services, pamphlets, and people in place to help you. If at any time during your visit you have questions or need help, please do not hesitate to ask. Our team works hard to make everyone's experience the very best we can. We welcome your suggestions for making a medical intensive care unit experience even better. Our goal at University of Iowa Hospitals and Clinics is to provide the best possible medical care to your loved one and to you to help you through this journey as well.